Let's take a look at stress and some self-care techniques that can help mitigate its impacts on our bodies and in our lives. Stress is a normal part of life that can help us learn and grow, or it can cause us significant problems. Stress is the automatic physical, mental, and emotional response to a challenging situation. The stress response is triggered when your brain perceives a threat, or you face a situation in which it seems that the demand outweighs your resources to cope effectively. When the stress response is triggered, the sympathetic nervous system is activated, which contributes to the fight, flight, or freeze response. This response causes heart rate to increase, blood pressure to increase, and breathing to become shallow. Energy resources are diverted away from digestive organs and towards the muscles so that the body is prepared to respond to the stressor. The hypothalamic pituitary adrenal axis is a complementary reaction to the sympathetic nervous system. The hypothalamus stimulates the pituitary gland, which signals the adrenal glands to release the stress hormones cortisol, adrenaline, and norepinephrine. Cortisol increases the body's metabolism of glucose, which is needed for adequate fuel supply to fight or flee from the stressor. And adrenaline and norepinephrine are released to help mobilize the brain and body for action. This is all normal and okay, unless cortisol is elevated for too long, which can lead to weight gain, elevated blood pressure, irritability, and an increased risk of chronic disease and psychiatric disorders. The cost of a lack of self-care and adequate stress management has many potential implications, including burnout. Burnout has been defined as physical and emotional exhaustion involving the development of negative self-concept, negative job attitudes, and loss of concern and feelings for others. It is a state of physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding situations. Burnout is characterized by emotional exhaustion, depersonalization, and reduced feelings of personal accomplishment. In other words, when you're feeling burned out, you become less effective. You may start showing up late for work. Your mind wanders while you should be attentive, and you may lose the capacity to relate to your clients. Emotions are so physically and biologically based in the body that we can't afford not to look at the whole person. A focus on integrated wellness perspective will help provide you with a lens through which you can explore your unique health and wellness lifestyle. Wellness has been stated as being the process and state of a quest for maximum human functioning that involves the body, mind, and spirit. Evidence suggests that physical activity, nutrition, adequate sleep, social interaction, and our environment are inexplicably intertwined in our health paradigm. Physical wellness includes nutrition, exercise, hydration, and sleep, among other things. But physical health is more than simply attention to diet and exercise. It has been suggested that physical wellness goes beyond the mere absence of illness and toward personal choices that encourage proactive healthy behaviors. Even mild exercise several times a week can have a beneficial effect on the neuroendocrine system and increase self-efficacy and self-esteem. Further, a positive connection to nature can reduce stress, increase focus and concentration, enhance academic performance, and increase vitality. A simple brisk walk at the beginning and end of each day can provide a needed transition, a time to reflect upon the day's activities, and provide physical activity to an otherwise physically inactive day. Make your daily physical activity a way to break up the routine and improve your outlook, along with providing your body its needed movement. Nutrition and exercise are intricately connected to our emotional health. A diet high in sugars and saturated fats, which is nutrient insufficient, may have a negative impact on our moods and cognition. But rather than looking at our eating habits from a deficit model, or one in which say, I have to diet or I can't eat this. I suggest that instead you imagine yourself intentionally eating well. Adequate hydration is also important for proper functioning of the body as well as the brain. When we are well hydrated, our brain cells are better supplied with fresh oxygen-laden blood, and the brain remains alert. Mild dehydration can impair the ability to concentrate. Loss of more than 2% of body weight due to dehydration can affect the brain's processing abilities and impair short-term memory. Physical wellness is not limited to simply diet and exercise. Sleep is also an important part of overall health and well-being. People are often unaware of the risks of sleep deficiency and may not even realize that they are sleep deficient. When you don't get enough sleep, you're slow, vacant, and lack focus. The reality is that most adults need 7 to 8 hours of uninterrupted sleep each night. Studies show that sleep deficiency alters activity in some parts of the brain. If you are sleep deficient, you may have trouble making decisions, solving problems, controlling your emotions and behavior, and coping with change. Sleep deficiency also has been linked to depression, suicide, and risk-taking behavior. Getting enough quality sleep at night helps you function well throughout the day. People who are sleep deficient are less productive at work, they take longer to finish tasks, and have slower reaction time and make more mistakes. So let's look at some other tools that we have in our stress management toolbox. Self-compassion. Self-compassion is an essential component to self-care and stress management. Self-compassion is the ability to have compassion and understanding for yourself despite your perceived inadequacies and sufferings. One way in which it can be viewed is self-kindness versus self-judgment. Self-compassion is the antidote to self-pity, selfishness, and complacency. Research suggests that individuals who practice self-compassion ruminate less about their challenges and have better self-efficacy, a stronger personal accountability. Mindfulness. A rapidly growing body of evidence indicates that mindfulness is an effective and beneficial form of treatment for a variety of mental and physical conditions. It can be a powerful tool for decreasing the stress response, lowering blood pressure, and strengthening the immune system. Mindfulness is often a component of mind-body practices such as meditation and yoga. However, it can be practiced outside of these activities. Mindfulness involves bringing attention and awareness to the present moment without judgment or evaluation. The ongoing practice of mindfulness is beneficial not only for a sense of meaning, purpose, and overall well-being, but also for the mental mechanisms that affect the brain. As such, mindfulness may be a useful tool in minimizing burnout and enhancing stamina. Breathing. Breathing is a powerful way to promote changes in the nervous system, shifting you from a sympathetic state, which is stress dominant, to a parasympathetic state, which is relaxation dominant. Deep breathing has a profound impact on your physiology and health, altering the pH of the blood, lowering blood pressure, stimulating digestion, and helping you feel calmer. Creativity. Studies have shown that participation and/or engagement in the arts have a variety of outcomes, including a decrease in depressive symptoms, an increase in positive emotions, a reduction in stress responses, and, in some cases, even improvements in the immune system functioning. Creative self-expression and exposure to the arts have a wide-ranging effect on not only cognitive and psychological health, but also physical conditions such as Parkinson's disease, various forms of dementia, and cancer. A study by the American Academy of Neurology supports the idea that engaging the mind may protect neurons, or the building blocks of the brain, from dying, stimulate growth of new neurons, or may help recruit new neurons to maintain cognitive activities in old age. Creativity is increasingly being validated as a potent mind-body approach, as well as a cost-effective intervention to address a variety of challenges through the lifespan. And lastly, humor. Humor can, in fact, be very healing. It elicits our playful selves and allows us needed momentary escapes from the seriousness of life. So in wrapping up, self-care refers to any activity you do to support your emotional, mental, and physical health. A common misconception is that self-care is a luxury, or that it is selfish. However, as we have seen here, self-care is crucial to prevent the adverse effects of stress. Self-care needs should be intentionally planned based on your personal needs and preferences.